Good day, everyone. Today is Test Tip Tuesday, and today we're going to talk about how to answer negative event query questions. So, here is your NCLEX question of the day, and it is inspired by our NCLEX Review Masterclass, where this week we are focusing on physiological adaptation. So we're focusing on physiological adaptation and we're breaking down everything by systems. So each day we're tackling a different system. Yesterday we did renal system, and today we're going to talk about cardiovascular. All right. So first, what is a negative event query? A negative event query will ask you to make a decision and select the option that is inaccurate or incorrect with regard to the data presented in the question. Sometimes a negative event query is asking you to choose an answer that is abnormal. There's some abnormal data. There's something in there that's expected, but there's some answers in there that are unexpected. Maybe it's harmful to the patient and concerning, like a complication. So, negative event queries are going to be related to that. How will you know that the question includes a negative event query? You have to practice questions and you have to understand how those questions will present themselves and in what way will they word the question. In this case, the question is, or the query is, which of the following findings indicates a serious complication may be occurring? So, although I'm looking for a positive correct answer, that means a complication is occurring, my answer choice is going to be negative. It's something that's abnormal, not expected, could be harmful to the patient, could be life-threatening or deadly or whatever, but it is a serious complication. So I'm basically looking for a finding, which is a assessment finding, that tells me, because of what's going on with this patient, that a serious complication is occurring. So that's a negative answer. I'm going to answer this question negatively. So you want to read the question carefully and focus on the query of the question: serious complication. The query contains words or phrases that are going to indicate the question includes a negative event query. So generally, these queries are used in evaluation type questions like an assessment or evaluating the effectiveness of a treatment or a procedure or medication or teaching. In this case, we're going to be assessing for or evaluating for a complication. So negative event queries are used less frequently on the NCLEX than we see positive event queries, because a lot of times they're wanting to know, what are you going to do? But you do need to be alert in noting these types of questions. In this case, it is a little bit of action, because sometimes they want to know if you know how to do a certain thing, such as assess for a negative thing happening, something abnormal, a serious complication. So in this question, we're going to go back to our case event. Our case event reads: the nurse is caring for a client recovering from a cardiac catheterization. So that's who's your patient. That's what's wrong with them. They're a typical adult patient, and this is post the cardiac cath. This is not before. It's not during. They're recovering. So that means this is after. That's our time proximity. Sometimes that makes a difference in how you are answering the question. After they've had this cardiac catheterization, now they're recovering. The introducer sheath has been removed from the right femoral artery, and a pressure dressing is in place. So now we're pretty much at a state of like monitoring the patient after this heart cath. And as you're monitoring them, you're going to be assessing for findings, complications, assessments that may indicate something wrong is going on or something's happening. Typically for a cardiac catheterization, it's going to be looking at the insertion site, the dressing, monitoring for bleeding, hematoma development. Do they have a good pulse in that leg that they went in that right leg? Is the extremity cool or pale? Things like that can indicate that the patient is either clotting or bleeding. Either one can happen. So we know we're looking for a negative So we're going to use our process of elimination. If you read through your answers sometimes and just try to choose the right answer, our minds gravitate to things that sound good. So what you rather do is eliminate the incorrect answers. In this case, what is incorrect is going to be something positive or expected in relationship to this person who just had a cardiac cath. There are going to be some things that may be abnormal in general, but for this patient, it's kind of normal. It's expected because they just had a catheter sheath going up into their right femoral artery, into their groin, and they just had a heart cath. All right, let's look at A. Creatinine level is increasing. That is not a good sign. If it's going up, that can be a sign of renal damage. We're going to say that is a negative. And what you want to remember for a heart cath is that these patients will receive contrast dye or contrast medium, and that is potentially harmful and harsh on the kidneys. So we have to make sure that dye is cleared. We want to make sure those patients are well hydrated after the cardiac cath and probably before, during the process, leading up to after, so that their kidneys are working well and being flushed effectively. So if creatinine is increasing, that tells me their kidneys are not releasing that creatinine. They're not filtering it out appropriately if it's trending up. Option B, ecchymosis is present at the insertion site. You want to know general medical terminology. Ecchymosis refers to bruising. It's a bruise. It doesn't tell me how bad the bruise is. We would monitor for bruising because that could indicate bleeding. But would I expect there to be some bruising at the insertion site? Absolutely. If someone put a large catheter into an artery, it's going to bleed and clotting is going to happen, and there may be some bruising. So it doesn't really give me any significant words to alert me that this bruising is that significant. All right, since we have eliminated option B, we're getting rid of it because it is a positive in a sense that it's expected. Bruising is expected after a cardiac catheterization. They don't say it's significant bruising, and we're going to continue to monitor that. That's something we can monitor. Option C, discomfort at the insertion site. There again, as you can see in the picture, they have inserted this large introducer sheath into that right femoral artery, so it is expected that it will be uncomfortable. Discomfort, it doesn't say that this is severe pain or any abnormal type of pain. Option D, extremities are warm bilaterally with trace edema. We want the extremities to be warm in their lower extremities. We want their legs to be warm. That shows that there's good circulation. So this is normal. We'll put an N here for normal. And trace edema may be expected a little bit. They haven't been up walking around and moving around for a period of time. And so potentially they could have a slight small amount of edema, not even enough to give it a +1 or +2, whether it's pitting or dependent. It is just a trace. So we can just say that this is also expected. So we'll eliminate all of those that we thought are expected or positive answers, and we will narrow it down to our most negative answer. The one that is most concerning, it can be indicating a serious complication that the patient is experiencing AKI or some renal deficiency or insufficiency due to the contrast medium. Remember, these patients will be getting contrast dye or radiopaque dye during the heart catheterization, and that can cause injury to the kidneys if it's not flushed properly. So we do want to continue IV fluids on this patient, but we would have to update and let the healthcare provider know that their creatinine is increasing from their baseline. All right. So that is how you would answer a negative event query, one that is asking you for an indication of a serious complication. Look for the answer that is most negative and that relates to the condition or the problem or whatever is in the case event, what happened to the patient. Relate it and link it together. If you don't remember this option or if you got this answer incorrect, then you want to make a note. Cardiac catheterization. What can result of a cardiac catheterization? You want to monitor their kidney function, their BUN and their creatinine. I hope this helps. Thank you and have a wonderful day. We'll see you next time.